Welcome to the podcast. That's Dr. Mia, Navigating Dementia Caregiving. And today I am really excited to talk with Dr. Christina Hugenschmidt. Christina is a friend and a colleague. She's an associate professor within the Wake Forest University School of Medicine and the director for the Wake Forest Memory Counseling Program. But what is really unique and interesting about Christina is that she's not only a mental health counselor, but actually also a neuroscientist. So she really approached neuroscience from a counseling background, going back to graduate school. And now her research is looking at brain imaging to look at how mobility and movement and diabetes affect the brain and how those things could be changed or modified with lifestyle interventions like exercise and the arts. So, welcome to the podcast, Christina.
Thanks for having me, Mia. This is very exciting.
Thank you. And I asked Christina to join me on this podcast episode because we both attended the recent Alzheimer's Association International Conference, also short AAIC. It is the largest international conference for people who are in Alzheimer's disease and related dementia research. It's hosted by the Alzheimer's Association. And this year, it was happening. Um, I didn't go in person, but Christina did. And so I wanted to talk with her just about the things that would be exciting for our listeners, folks who are sandwich generation caregivers. And Christina is one as well. So, Christina, if you can tell us a little bit about who you're caring for and how is that going?
Yes, so I help with caregiving for my mother. I would say my dad at this point is her primary caregiver. When he was getting adjusted to that role, I was had more of a lead in her caregiving at that point when he was adjusting to the role. But my mom has kind of an interesting path with this because we were able to get a very early diagnosis of amyloid in her brain because she was part of the A4 study, which was looking at the drug aducanumab, which is related to the drugs that were recently approved. Did I get the drug name right, Mia?
Yes,
Oh,
yes. So,
sorry. That was off the top of my head. Yeah, so she was part of the A4 trial, and that was looking at aducanumab. So for that drug trial, she had to have amyloid in her brain to be accepted into the trial. So we knew as early as 2015 that she had amyloid. And that journey for us kind of started with an incident in our kitchen, actually, where she was unable to find the silverware in the kitchen in the house that she grew up in. And
hmm,
for me, that was just a red flag that something might be not quite right. So even though her cognitive testing at that point was normal, I felt like she might be having some changes, and we signed her up for that study to try to be proactive. That was totally her choice. So that was
yeah.
kind of where it started.
All right. And how old was your mom when you noticed the incident about the kitchen not being able to find the utensils?
Um, I think she was around 70. It might have been 68 or 69, but it was around 70.
Okay. And then how is she doing now?
So she currently has moderate stage dementia. And kind of the trajectory of that was knew she had amyloid in her brain starting in 2015 when she was part of the study. Probably around 2019 or 2020, she got a diagnosis of mild cognitive impairment. And then I think it was either fall of 2022 or very early in 2023 that shifted to early stage dementia.
Okay. So you approached the conference with multiple hats, as a sandwich generation caregiver, as a neuroscientist, and of course, as the director of the memory counseling program. So we're going to kind of hit three main buckets of research and presentations at AAIC. The first one, I think we both wanted to talk about what are some things that our listeners could do right now for their health, for the future of their brain health. And then we can talk about what are some exciting studies or research that was presented that may be relevant for the loved ones that you're caring for. And then finally, kind of just talking about the hope for the future for Alzheimer's disease and related dementias in terms of the science and things that we found to be really exciting in terms of the field moving forward. So, Christina, what did you find useful or potentially really exciting about caring for yourself?
Oh, you and I definitely have already talked about this, but the Pointer study was some of the biggest news coming out of AAIC altogether. And of course, Wake Forest, where we are and have been, is a big piece of that work. So that was great too. But the really cool part of that study that's important for caregivers to know is that um, the dementia, like I talked about with my mom, this is a long trajectory, right? Like we could see the buildup of the amyloid in her brain a decade ago. So, this is a long time, and she's still actually pretty healthy. We still have a way to go ahead of us. But part of the importance of that is we could see that build up over like a decade ago. We probably could have seen it earlier if we'd looked earlier. So for caregivers, knowing that that disease starts early is important because lifestyle interventions may be able to affect it. So the cool thing about Pointer was everything they did is things that people can do on a daily basis. They help people form social groups to have adopt a healthier lifestyle, and the healthier lifestyle involved taking medications that they needed to take to control things like hypertension and diabetes, um, exercising regularly. And this involved getting your heart rate up for at least 150 minutes a week, like you're recommended to do. And it's important to note they did this with a team. So you had friends supporting you, you had people supporting you to help you make those changes. They also help people to adopt healthier diet habits and also work on their sleep. But they did all of this in a way with support. So, as a group of people helping you, you started new things at new times. You weren't trying to start everything at once and like crunch it all in. You know, you're adding a little bit of healthy stuff here, adding some exercise there. And then over the course of 2 years, you build up to this set of a whole constellation of healthy habits. And they found when at the end of the 2 years that people actually had taken it was the equivalent of reversing brain aging by a couple of years. So that is huge, and it's actually a larger effect than we see from anti-amyloid drugs in terms of the benefit. So that's huge, and it's important for caregivers because this study was in people who did not yet have memory loss
Hmm.
and people who were at slightly younger ages as well as older ages. So whether you're a spousal caregiver or a child caregiver, this would apply. Um, but it is important that it was before there was any diagnosis of cognitive impairment.
Yeah, no, I think Pointer did a really great job of recruiting participants who are really reflective of the folks that we see in
Mhm.
the community. So it was almost 70% women. 30% came from an ethno-racial group that's not white. And then 30% are without a college degree. And like most Americans, have higher risks for cardiovascular disease, whether that's high cholesterol, high blood pressure, or both, or diabetes or pre-diabetes. And the majority of them have a family history of someone with dementia or memory loss. So this is definitely relevant for the folks who are listening. And just as you said, Christina, I think their average age was around 68, which you know, when you look at older adults, in my mind, that's actually not old at all.
Yeah.
And it's actually right around the time that probably your mom, when you guys have first noticed her memory changes. And just as you said, this was not a placebo controlled trial in the sense that both of the arms had active intervention. Like both groups did this comprehensive list of lifestyle changes, including mind diet, physical exercise, health monitoring to monitor for blood pressure, cholesterol, blood sugar, as well as cognitive exercises. And they used a program called Brain HQ, which is available, just by Google. And that in the study itself, they did about 30 minutes of these computer-based brain training 3 times a week. Plus, they have regular engagement in other, challenging and social activities. The two groups really differed in terms of how much support the study gave. In the structured intervention, the more intensive intervention arm, they had like facilitated team meetings, 38 of them over 2 years, and definitely, within the group of participants as well as with these coaches, really kind of formed a community to improve their overall lifestyle. But the other group, notably the group that was getting the less intensive and self guided, they only had 6 meetings over the 2 years, and they were, basically just given this general information for people to do without the goal directed coaching. And both groups actually improved in terms of their global
Mhm.
memory. And when we look at their, subtypes of memory, this is really noticeably improving in what's called executive functioning, which I think is really even more important than short term memory. Because if you don't have executive functioning, it's hard for you to figure out how to use the computer or a remote, or how do you cook a meal when you know the recipe and have been cooking the same thing for forever. So I think the the scientific basis of the type of memory that improved also makes sense, because we know those are the things that are important in both heart health and brain health, and that we see those changes being reflected in the study results. And I know, you know, this was one study that was very very much got a media blitz, and I had a patient actually call in asking about how can they sign up for the pointer, and I'm like, wow, here's some information I can give you, and you can start right now. But I would have to say that, I even checked out the Brain HQ website, because I was curious as to what type of memory training this was. And I think it's practicing like visual spatial short term memory, which to some people that might be fun. But I would say if that's not enjoyable to you, it definitely is not something you have to force yourself to do just because it was studied in this particular study.
Yeah. I guess I would add on to that by saying that I think it was the Achieve study where they first saw improvement in speed of processing in response to speed of processing training. That is, I think, one of the only studies, or at least the most robust study, to show that cognitive training by itself can improve cognitive function. But I think that's important in the context of this too, because in the Pointer study, they were talking about the fact that people didn't always love the cognitive training. They
Hmm.
weren't as sure of the cognitive training dose. And there's a lot of evidence about exercise, and that exercise can improve executive function. So I think um, it's really important that the exercise, I would say, is really important. I think there's also a lot of emerging evidence about the importance of social engagement and social
Hmm.
communication. So both groups improved, like you said. Both groups also had a group component where you were put with like a team that was all trying to change their behavior together. And then, like you noted, the one that had the biggest improvements was actually had a coach. And the coach, I do think this is important because the coaches were trained in psychological techniques to help people be more likely to take up behavior change. So I think that some of those things also point to the fact that um, when you're a caregiver, it's really important to both ask for and accept help. And some of the help that you might want to be asking for and accepting can be around your own personal health. And that can be accepting coaching from somebody at the Y. It can be accepting help from friends. And that something simple, just like joining an exercise class or a walking group or a jogging group, some group that gets together can be really healthy and really help you even more to support those lifestyle changes because you can't always do it on your own. You shouldn't think you have to do it on your own. It's a team sport. Caregiving is a team sport, and caring for yourself is also a team sport.
Yeah, absolutely. And I know from personal experience, I definitely work out longer and with higher intensity when I'm in a workout class. I go to Orange Theory, no affiliation or promotion on behalf of them. But I have to say, I do it for a lot longer than if I were to work out at home by myself. And there is, that coach being there telling me to, keep running when I feel like dying. Um, but but yeah, I'm just curious. I know you also are interested and have attended some talks about just our particular age group, this perimenopausal 40, 45, 40, 50, getting to menopause and all of the hormonal changes that are happening at this time of our lives when we're busy with our careers and our kids and our parents. You know, just a couple days ago was my mom's 1 year anniversary in terms of her passing, and I just remember, the 2 years when she was sick with cancer were some of the most emotionally exhausting years of my life, and, so, I mean, that's why we're talking here, and hopefully for those who are listening, want you to feel like we're here for you, and, yeah, so coming back to hormones and perimenopause.
Yeah, this is such a hot topic right now too, and I will say I've done a little bit of research in this area as well, so it's part of why it was really interesting to me in this meeting. But like you said, women in our age range, women are the most likely to be caregivers. Women are also the most likely to get Alzheimer's disease. And we do seem to be at actual elevated risk. That seems to not just be because of increased longevity. And that was something that was brought up multiple times in this meeting.
Mhm,
So I do feel like it's important whether I feel like probably a lot of people listening to this who are caregivers are women, just statistically, that's the
mhm.
case. But also, even if you are a male, you have women in your life that are probably also involved in this as valuable information. But if you are caregiving, say, for your mom who has dementia, which is such a common situation, then you know you have family risk. Um, we also, like I said before, know that the pathology begins developing up to 20 years before the onset of symptoms. So if you bring that back to my mom, those very first symptoms we saw when she was like 68, 69, she may have been getting um, amyloid buildup in her brain at my age, at 48, right? 20 years earlier. That may have just been in its baby beginnings at my age. And that really brings home to me, listening to all these things really brings home to me that no matter how busy I am, um, it is very important to do these kind of things that they were talking about in the Pointer study to whatever level I can. It may not be perfect, but whatever piece of that I can incorporate into my life is going to be healthier for my brain because we know that in this time of menopause and perimenopause, there are metabolic changes in your brain. So the way your brain uses sugars during this time can have really dramatic shifts. There are also differences in sleep patterns, and we know that sleep is really important. And it was one of the things targeted in Pointer that they tracked and that they looked at. Um, and we also know that those two things aren't separate, that when your sleep is
Mhm.
disrupted, it disrupts things like your cortisol and your stress levels and your metabolism. So just realizing that as a caregiver, particularly if you're a female at this kind of vulnerable turning point with your hormones and all these changes, the stress of caregiving, you can feel like there's just not enough time to do these things, but any amount that you can do of exercise, keeping up with your health and wellness appointments to the best of your ability, trying to eat healthily when you can, that all of those things are really important for protecting your own brain and your own health so that you can continue to care for your loved one with dementia and for your family.
Yeah, and we're going to come back to talk more about food and diet and the gut-brain axis because I was texting Christina during the conference. I was like, "This is so cool! This
Yes.
gut-brain axis." So we'll touch on that. But wanted to turn the conversation a little bit into kind of research that may be relevant to the loved ones you're caring for right now, people who might have either mild memory changes like mild cognitive impairment, or they're on the dementia journey, whether that's mild, moderate, or severe. So one thing that I heard during the talk that really didn't get as much publicity as I had expected was from this group, a company called Axome, Axome, where it looks like they tried different combinations of existing drugs for different indications. But the presentation was about AXS 05. The actual name doesn't really matter, except that it's a combination of dextromethorphan, which is like the DM part of your cough syrup, and then bupropion, which is the generic name for Wellbutrin, which is a pretty common anti-anxiety, antidepressant medicines, more for anxiety than depression, and that AXS05 basically is combining the two into one pill. And they did a phase 3 randomized control trial. So one arm was getting this medicine, this combination medicine, in people who have Alzheimer's disease and related dementias, as well as behavioral changes. And the other group was just getting placebo. And both groups were getting it twice a day for the study duration, which was 26 weeks. So they were looking at things like whether caregivers reported that they are noticing changes in terms of the behavior, as well as looking at potential side effects. So we know with antipsychotic medications that are commonly used off label in people with living with dementia and potentially violent behavior or other challenging behavior, that all of those antipsychotic medications not only make their memory worse, but also have higher risk of death. That's why they have a black box warning, as well as make it more likely for people to fall, break a hip, have low blood pressure. Uh, this study on the dextromethorphan and buprenorphine combination surprisingly really didn't have a lot of those same side effects that we see in antipsychotics, which was a little exciting. And just knowing about how commonly probably a lot of people are on these meds also is a little reassuring for the geriatrician mind in
Mhm.
terms of understanding the drugs and not that they're not totally brand new. Just curious from your perspective, Christina, from a neuroscientist perspective, why do those two drugs work well together?
I can't tell you that because I'm not a pharmacologist. There's neuropsychology is a really broad field, and that's not my area of study. But I was also super excited by this talk. I think you and I, because you were attending virtually and I was in person, we didn't know that we'd both gone to that one. But there were some things that I loved about the talk. One is that he was talking about combining the drugs, and he called that rich pharmacology instead of a dirty drug. He was also talking about the fact that that combination of drugs extended the time over which the drugs were effective. And that was really important because one of the limitations prior to this was that um, the drug might be effective, but that it on its own, but that it was very short term. When they put the two together, they could get this safe drug that also had a reasonable time course. And like you were saying, there's so little for caregivers and people with dementia for these kind of agitation symptoms. And sometimes it's violent and it can really be dangerous for caregivers or difficult to contain or can cause somebody to have the need to be in a placement. Other times it may not be quite that extreme, but it's still preventing you or the person that you're caring for from sleeping or from getting things done during the day, or it's preventing you from being able to bring caregivers in because they can't handle those behaviors. So, and those things also are presumably not pleasant for the person experiencing them. So, it's really nice to think that there might be a drug with a better safety profile that can really help caregivers and people with dementia with those present right now symptoms until we get drugs that can actually cure these things longer term.
Yeah, and I want to make sure that our listeners are not listening to this and then going out to buy Cough DM, Mucinex DM in combination with their Wellbutrin. Please don't do that because they're still in the process of seeking FDA approval. And I want to make sure that we talk about how behavior is really just an expression of an unexpressed emotion or feeling, because in people living with dementia, they have trouble communicating. And so a behavior might be a way for them to really say that they're in pain, they're uncomfortable, they're bored, they're overtired. Um, all of those things are important to try to address non-pharmacologically, but certainly having more options from a medication perspective that is hopefully safer is really exciting to me.
And kind of touching on what you were just saying, some of the other interesting things that I think we both heard had to do with that. Other contribute like the contributors to agitation, things like changes in sensory function and beginnings of research to look into different ways to address sensory function better because as people get older, everybody as you get older, you lose sensory acuity in all five senses and your sensory perception changes. But with dementia, and it can vary across different kinds of dementia or the stage of dementia, but you can also get even more perceptual changes. It often goes with hearing loss, there are vision changes, and some of those are normal aging related, but some of them also are due to the dementia itself and might include things like hallucinations or visual distortions. So, addressing those can also sometimes help address the agitation because if someone feels more confident or is better able to perceive their environment, hear what is being said to them, see the things around them, then this can also help with reducing agitation.
Yeah, there is actually a study that they're looking at over-the-counter hearing aids, as well as a senior volunteer coach who can potentially teach the caregivers to use hearing aids for people living with dementia and have agitation and challenging behaviors. That study is ongoing, and we will hopefully know the results soon. But I think whether it's pain or hearing impairment or vision impairment, it makes sense, logically, and that if your world is confusing, I will be feeling anxious and kind of maybe lash out at my environment because I just don't know what's going on, in addition to the cognitive and the processing changes
Mhm.
that's happening in the brain. So anything we could do to optimize that, I think will be is great and is within our control. Now, there's always going to be people living with dementia who just absolutely refuse to wear a hearing aid or any sort of hearing amplifying device. But there may also be other people who, you know, once they know that this is something that could help with their brain, I think may be more willing to wear hearing aids that they have available, but didn't think it was important enough to wear. Yeah. And then, so finally, let's talk about some of the research that we both found really exciting. And I think I'll just ground our conversation a little bit in the mind diet. So, going back to the pointer study, one of the key components was diet, was nutrition. And
Mhm.
so, the mind diet really emphasized dark leafy greens, berries, nuts, whole grains, olive oil, and fish, and really limits the intake of sugar, cheese, red meat and unhealthy fats. I think this is not necessarily news to those of us who are in this space, but I think what I found was really fascinating was when they look at the stool samples of people who are amyloid negative versus amyloid positive. So, this, protein in the brain that we think is one of the causes of Alzheimer's disease. Um, the amount of these short chain fatty acids that are contained within fiber rich foods like in the mind diet are more present with a more diverse microbiome, so lots of different bacteria in the amyloid negative group compared to the amyloid positive group. So they also saw less short chain fatty acids in older folks and women and those who have an ApoE4 status. So that's the gene that gives people a higher risk of developing Alzheimer's disease. So all of that I found to be super fascinating. It's not just to say, eat this diet and you'll be better, but really looking at the underlying mechanism of how does that diet make our brain better.
Yeah, that is totally fascinating. I don't think I heard that specific talk, so I'm actually really glad to get that from you.
But what was your impression of kind of this whole brain gut relationship?
Well, it was an emphasis here, and I was excited about that for some of the reasons that you're saying. There was also some new things that I learned about it. Um, One was that one of the people who was speaking was talking about the fact that she began looking at the gut brain axis and whether some of those things were changing prior to the onset of symptoms versus after, because those of us who are caregivers also know that diet changes with the disease, right? People's palate changes, what they want to eat change. You can't force people to eat things at some point, but she was interested in whether that was changing first. She was also interested in the question, was there any potential that some of these proteins that we think are causal in memory decline might be present in the gut or somehow getting out of the gut and up to the brain? Because we know there are all of these really important brain body connections. We know that both the gut and the brain have natural cellular barriers when we're young and healthy, and that for both the gut and the brain, those barriers, the blood brain barrier and gut integrity, can be affected by aging and in Alzheimer's disease. So she was really curious if leaky gut might be allowing things that ought not to be coming from your gut to get to your brain to happen. So she found that that was happening, and even that amyloid from the gut might be getting to the brain. So there were two cool things about that. I think one was, like you were talking about, the importance of gut health for brain health and potential mechanistic links of between what's happening. But a second really cool part of that is that she also asked the question, well, if that's happening, how, right? Like, there's got to be something transporting it. Is it just flowing up through the blood or is it being transported? And she was able to find that it was being transported. And the really cool thing about that is one of the most difficult aspects of drug delivery to the brain is getting across the blood brain barrier, that natural barrier that the brain has between what's in the blood and what's actually inside the brain tissue. That's very tightly controlled. So, she this discovery that she made might also open up a new pathway for new drugs that are developed to get into the brain in a better way.
Yeah, I think this was the plenary talk by the researcher from South Korea who looked super young, but she had beautiful skin, and I just wanted to be like her when I got older. Um, talking about the gut brain relationship and how I think she had one slide that talked about just how common constipation, inflammatory bowel disease, irritable bowel disease, as well as a number of other GI related issues, and how that was so much more common in people who have Alzheimer's disease. And it's fascinating. I think it does relate to the leaky gut versus the leaky brain. And I think, in fact, her study or her lab looks at, the gut transmits stuff to the brain via the blood, but the brain transmits stuff to the gut via a nerve called the vagus nerve. And so, I don't know, the nerd in me was just really excited because the vagus nerve controls so much stuff, is our parasympathetic nervous system, as well as the nerve that we can activate when we take a deep breath. All of the things that I think we're probably not doing enough, and knowing that it's related to this gut brain relationship. As you have mentioned, Christina, I think this also opens up new ways of getting drugs into the brain that doesn't cause too much toxicity, because part of, whether it's chemo or even anti-amyloid drugs, is that getting through that blood-brain barrier could be potentially also causing side effects, that because the barrier itself becomes leaky. So those blood vessels, whether it's, the amyloid related imaging abnormalities or swelling of the brain or small areas of bleeding in the brain, those are the side effects that, really relates to how the drug is working.
Mhm.
um, and so, if we have a natural way that our body is communicating between our gut and our brain, you know, s- lots of other stuff that we can take by mouth and be digested, and maybe will go up to our brain.
Yes, yeah, and so there are 2 directions, and I wanna take this, and I don't know which one to go first, but where you stopped, maybe the next logical one would be that there was another really cool talk that was actually about lecanemab, which is one of the approved drugs, and I didn't realize this, but they were saying that currently the way lecanemab gets into the brain is actually through the leaky blood-brain barrier, so it doesn't have a great delivery system, and one of the results of that is it's not always evenly distributed across the brain.
Mm-hmm.
So this group was looking at a new way to have it receptor mediated transport, which would mean the drug is actively pushed across the brain blood brain barrier. And they showed some beautiful images of how that made the lecanemab more evenly distributed across the whole brain. So the whole brain was more evenly targeted by the drug. And they were also saying that in their first stages of these trials, that there were fewer symptoms like you were talking about that we are concerned about with those drugs, like the brain swelling and bleeds and things like that. And they thought it was because it was bypassing, it was being taken directly in and not depending on the leaky blood brain barrier, and that that might be reducing some of those symptoms. So that was really cool.
Yeah. What was the other thing you wanted to talk about?
The other thing with the gut brain, as you were talking about it, this actually brought me back to my mom. So I've known for a long time because, like you mentioned in the beginning, I'm interested in type 2 diabetes and obesity. And one of the interesting things about obesity is that as weight gain and loss have a natural age related trajectory, but that has changed in dementia. And most people who are dementia caregivers have experienced that people with dementia often experience weight loss and they can often undergo periods of rapid weight loss. And there's actually a point at which I was reading about this, and I found a paper back from like the 1950s where
Oh.
a neurologist was talking about unintentional weight loss being a diagnostic factor for Alzheimer's disease, that it
Uh-huh.
differentiated it from some other forms of pathology that could be happening. So with my mom in 2020, she experienced 30 pounds of unintentional weight loss. And she really, it was dramatic. It happened over 6 months. And it, what was interesting to me was we finally got it addressed and by Dr. Kate Callahan, who we both know and who is also an amazing physician. She was like, took care of that for my mom. But what it turned out to be was an overgrowth of certain bacteria in her gut that was preventing her from digesting. But listening to that talk, it made me think about that weight loss piece that has been noted in Alzheimer's so many times. And it made me wonder about that with my mom. Was there some causal piece with this gut brain axis? Was that a turning point for her? Because that was right before she had a big inflection point and went on to early stage dementia, that she had that large weight loss,
Hmm.
amount of weight loss. and was having all of those gut problems. So that was definitely in my head thinking about that and thinking about maybe in the future, will there be ways for us to more rapidly identify or maybe even prevent some of that by having the right set of probiotics to give people when we see that memory loss is happening. I know there is research happening on probiotics to help maintain gut integrity. So it just, there's a lot of interesting future directions from this in so many ways, both in terms of treatment of the gut or the gut brain axis, and then in terms of exploiting that relationship to
Mhm.
deliver other drugs that may not be related to that, but may need to get into the brain.
Yeah, absolutely. And I think, I know we talked about this before, and in your mom's specific situation, it was a small bowel overgrowth of this bacteria, which is very difficult to diagnose. And I still remember when I was I think a medical student, one of the first patients that I saw, um, who probably in hindsight had mild dementia, but I didn't well, I knew something was wrong, but his presenting symptom was that he was losing a lot of weight and he was eating just as he's normally did. His wife was cooking the same thing. And I was so concerned about him having an undiagnosed cancer. I
Hmm.
scanned, me and my preceptor scanned him from head to toe. He didn't have cancer. But I also knew he was in conversation with me, there was something not right in terms of his memory. So I did some memory screening, and he definitely had memory impairment. So then I thought, well, is he just for? I mean, he couldn't just be forgetting to eat because he had a reliable person who was providing that food and he was eating the food. But it just did not make sense to me why he would lose such a huge amount of weight and have apparently no explanation for it. That conversation just reminded me of that particular case where I was like, I really don't know
Hmm.
why you're losing so much weight. I hope it doesn't continue, but I can't seem to find
Yeah.
out why it is that you're losing so much weight.
The other piece with the leaky gut that she brought up that we haven't talked about yet, but is sort of maybe interesting for people to think about if they're reading the news and they're reading about things like in inflammation and the relationship between inflammation and dementia, is that these certain kinds of gut bacteria can have byproducts, like little fragments that break off from them. And when the gut barrier is leaky, those fragments can get into the blood and can cause inflammation throughout the body. So that's yet another kind of link and pathway. So there's just so many things that it's really apparent that this gut brain axis is touching on, that like we've historically known about the weight loss, but we don't fully understand it. Maybe it's related to this, that we know inflammation is a component, and we know that when the gut barrier is leaky, that you can get increased inflammation from these fragments that can be there. We know that the composition of the bacteria is important for all of those things. So just so many cool directions.
Absolutely. And I think that the final thing I'm going to just mention, because as I was preparing for this conversation today, I also looked at the list of media press releases that was released from AIC. And one thing that I didn't catch during the conference but was publicized on the news release is that they had a first time looking at longitudinal study of the U.S. Supplemental Nutrition and Assistance Program, SNAP, or food stamps, and how that's linked to slower cognitive decline over time. It just made me think about like the relationship between having access to food, healthy food,
Hmm.
and how that's related to your overall health as well as brain health. And policy changes that cuts back on SNAP and healthy food really can have, not just hunger and of course poverty and all of that, but also had long-term impacts potentially into young people and children's growth and their brain health over time. So I'm gonna conclude that
Well,
conversation
can
today
I
on that.
Can
Please
I
go.
add one can
Yes.
I add one more thing that's important in that same vein?
Yeah.
Another major press release that they had, or thing that they talked about that's similarly kind of policy related, was the importance of lead exposure. There
Hmm.
was a really cool study where they were able to use kind of the variability and the use of leaded gasoline
Yeah.
across the United States to look at exposure. So these environmental toxicities that we know can affect the brain, it making sure that the environment and that these toxins are not in there is incredibly important at all stages. Like we're aware of lead and risk for children, but we don't think about what is at risk later on in life, and that's creating vulnerabilities later on in life as well.
Yeah, and I have so many patients who ask me, whether some exposure to whether it's mining or other industries that had a lot of pollution in the air, could that have related or military exposure to different agents that may or may not be classified as toxins by the Veterans Affairs Administration, and sometimes I just say I don't know because
Hmm.
I mean, I'm sure it wasn't great for your health, but as to whether or not that truly relates to your memory problems, at least for this study on lead exposure, I think this is the first time that there is such a noticed relationship. And I think the natural experiment of which areas had allowed, lead gasoline versus those who didn't allow that kind of direct comparison, which is just not possible within a randomized controlled trial.
Yeah. So
Yep.
interesting stuff. So many interesting things.
Yeah. Well, thank you so much for this conversation, Christina. I will link in the show notes some of the studies that we are talking about today. And then for those who are listening who really wanted to, hear from the presentations themselves, the AAIC virtual platform is actually still open and it's free. So people can still sign up and log in, although I'm not entirely sure. But I think this was a great thing by the Alzheimer's Association to make this scientific conference widely available and for free when usually, we have to pay money to
Yes.
attend. All right. Well, thank you, Christina. If you enjoyed this episode or this podcast, please click the follow or the plus sign in your podcast player. That way, you will get the new episodes populated in your podcast feed whenever it comes out. Thank you all and talk to you next time.